Hi, Mrs. Smith. This is your nurse Amanda calling back from Dr. Jones' office again. I just saw that you had some further questions today after our visit as far as things that you should avoid while you're pregnant, and I just wanted to re-clarify some things with you. I know it's a lot of information and sometimes it's hard to remember all of it. As far as the foods that we talked about avoiding, anything that can cause food poisoning that's not cooked all the way, such as raw eggs or sushi or soft cheeses, anything like that, that can lead to bacteria going to the baby, we don't like. And as far as anything that can cause food poisoning, that takes nutrients away from the baby, obviously. So we'd like you to avoid those kind of foods. As far as your question about fish, I don't think we covered that in our visit, but fish you can have one serving about every 2 weeks, just because there's a concern due to the high mercury content. So we want to make sure the baby is safe with that. Also, we'd like you to limit your caffeine consumption to 2 cups of coffee per day, just because increased caffeine can lead to blood vessel constriction, which can impair the blood supply to the baby. As far as over the counter medications, we did go over the NSAIDs, such as aspirin and ibuprofen, can also impair blood supply to the baby, so we want you to avoid those. You can take Tylenol, as you mentioned earlier today. As far as a common one that we see in pregnancy that you didn't mention is nicotine replacement. It's just not known if that's safe for the baby or not. So we prefer, if you are going to try to quit smoking, that you try and do that without medication first. Obviously, quitting smoking is important while you're pregnant. If you have any further questions about that, just let us know. As far as cold medicine, we recommend that you don't take NyQuil or anything strong like that, just because some of the active ingredients in that have been shown to cause birth defects. You can take children's cough medicine, but nothing that contains codeine or NSAIDs. Supplements are, there are a lot of them that are okay, like the ones that are included in your prenatal vitamins, such as your iron, calcium, that kind of stuff. Those are all fine. You really don't need anything outside of your prenatal vitamin unless your doctor recommends it. And there's actually some vitamins like vitamin A that can cause birth defects in high quantities. So we just ask, if you are wanting to take any other supplements or vitamins, that you definitely check with your doctor first. As far as environmental factors to stay away from, if you are going to use any cleaners, just make sure that you're in a well ventilated area. And just, if you have any trouble breathing, make sure that you get plenty of fresh air. We're just concerned about any respiratory distress to you, because that can lead to decreased oxygen for the baby as well. And as far as some cleaners are just not safe because of the risk of birth defects or decreasing blood supply to the baby. Pesticides, the same thing, and certain antibiotics can also cause birth defects as well. So definitely don't take anything unless Dr. Jones prescribes it to you. And you're also going to want to find someone else to clean the cat boxes for the duration of your pregnancy, just because of the risk of toxoplasmosis. As far as concerns about travel, you had a question about flying. It is safe to fly, and most airlines will let you fly up until 36 weeks. So not in your last month or so. And it's important for you to check with Dr. Jones before you go anywhere, because he'll want to go over with you concerns, make sure that you have access to safe food, clean water, stuff like that. Again, we don't want any food poisoning or anything like that, or diseases, bacteria from the water. And you'll also want to keep in mind that you may have difficulty finding safe medical care, and your insurance may not cover that care either. So that's some things that you may want to check up on ahead of time. And make sure that you carry your medical record with you just in case of emergency. So any doctor that you see will have access to your medical history and your pregnancy history. And the Dr. Jones would also want to talk to you before traveling, especially if you're going outside the country, because you may require additional vaccinations before you're leaving for that. The other travel concern that we would have is if you're sitting for long periods of time, if you're taking a long flight or a long drive, just want to make sure that you are stretching out your legs, walking, flexing your feet, stuff like that periodically, just taking some breaks from sitting. Because sitting for long periods of time can also impair your blood flow and can lead to risk of edema, like swelling in your feet and stuff, retaining fluid, and can also lead to risk of developing blood clots. So make sure that you're stretching and taking breaks, like I said, and elevate your feet whenever you can, just enough so that your knees are not at a 90-degree angle to relieve some of that pressure. As far as your question about the dentist, it is safe for you to get dental care. Go ahead and keep that appointment that you have scheduled for next week with the dentist. It's important to get early dental care in your pregnancy just to determine if there are any problems that need fixed. The best time for treatment is 14 to 20 weeks, but it is important if you have any dental issues not to delay getting treatment. It's always better to go ahead and get treatment because the benefit of treatment outweighs the risk to you and the baby if a dental condition gets worse. One thing that is common in pregnancy, you may experience some bleeding in your gums. That's totally normal, nothing to be concerned about. If it gets too uncomfortable for you, you can also, we have sensitive type toothpaste that you can use, and you can also get a soft bristle brush. Just make sure that you continue good dental care. That's always important, just so bacteria doesn't get to the baby and you don't develop infections and stuff like that. And it is safe for you to go ahead and get x-rays. I know that you're worried about the radiation risk, but it's a very small risk, and the dentist also has an apron that he can have you wear over your stomach that will help protect you and the baby from any radiation risk. One thing I also wanted to mention to you, it's our policy to mention to all our pregnant mothers, there are very high risks to you and the baby if you are drinking alcohol, using tobacco, especially smoking, or if you're using illicit drugs. With smoking, it can lead to hypertension and can also lead to low birth weight for the baby, and it's also a contributing factor to sudden infant death syndrome after the baby is born if you smoke while you're pregnant. If you are drinking alcohol, that can lead to hypertension as well, can lead to risk of gestational diabetes, and can lead to fetal alcohol syndromes when the baby is born. And also with illicit drug use, it can lead to preterm labor, birth defects, and can also lead to painful withdrawal symptoms for you and the baby from addiction. So again, it's just our policy to mention that. If you would like to talk more about any of that, please let me know. We'll see you on your next visit, and if you have any further questions or anything else I can answer for you before then, please don't hesitate to ask. Thank you.